Hello viewers, welcome to today's COVID-19 update, and today we have with us Director of Medical and Professional Service of the Georgetown Public Hospital Corporation, Dr. Fawcette Jeffrey. Hello Dr. Jeffrey, thank you for being with us today.
Hi, good afternoon. It's a pleasure being here. I'm hoping that I can at least answer some of the doubts and problems that are out there, and at least after this program we would have some clarifications.
Okay, thank you. Okay, first of all, introduce yourself. Tell us about your work at the GPHC and how it relates to this pandemic that we're in, COVID-19.
Well, I am an orthopedic surgeon first, but I am now the Director of Medical and Professional Services of the Georgetown Hospital. I have been so for greater than 1 year, 7 months, and being the director of the level 3 institution in Guyana, we are definitely directly involved in not only managing of COVID-19 patients, but also you need to remember that the Georgetown Hospital is the end point of medical care in Guyana. So whatever we do or whatever we advise is usually going to be the advice that is taken, because we are the institution that all the other regional institutions and other institutions would tend to emulate. So as the medical director of the hospital, we know that we have a major responsibility to not only the Georgetown population, but to the nation as a whole. So as DMPS, our intervention relative to COVID since the pandemic started and since we had our first case was to assist in the training and education of doctors, nurses, and all healthcare workers, not only at the Georgetown Hospital, but in the entire country. So we had trainers go and train persons to become trainers, so that at least there would be a uniform response from a medical point of view in the entire country. So that was our influence, Georgetown Hospital, to the country since the pandemic.
How was GPHC mobilized in the beginning when COVID-19 first came to light?
So that was interesting, because from the time we found out about COVID-19, which was, I think, the 26th of December, that's when it was announced by WHO, PAHO, that we had this new virus, new strain of the coronavirus. The GPHC started recognizing that we need to put things in place because it's inevitable that someday this virus would end up in Guyana. So we started by training. So we had sessions of training in the hospital for the use of PPEs, the use of the face mask, and the procedures that you should use to sanitize and stay safe. That's how we started. Then we continued by recognizing that if the Georgetown Hospital would have patients, we would need a place to put them. So we identified an area in the institution that we called the COVID ICU, the IICU, and we started our construction. By March, when the first case actually was diagnosed in Guyana, and that first case happened to be at the Georgetown Hospital, we were almost in the final phases of the development of this isolation area, which is in the northeasterly aspect of the Georgetown Hospital. So we were lucky. COVID gave us some time to get our act together, and we were able to get this isolation area prepared and ready. We had some challenges, but in the end we were ready enough to take our first case that we put in that isolation area in April. So that's how we actually mobilized. What we did also is we realized that there are many things that we needed to do if we were going to keep our staff safe, keep the patients safe, and keep our nation safe. So we started by setting up checkpoints, which we call screening points, in all the entrances of the institution. And then we had zones that are called triage areas. And these triage areas are where, if you're identified as possibly having symptoms that are suspect of COVID, you could actually be sent to a triage area where you will get a more detailed physical examination and interrogation using a checklist. And if you were deemed possible COVID, then you would actually be sent to get a swab. You would be sent to isolate or quarantine, or based on our findings, that's what we were doing. So that's basically how the Georgetown Hospital mobilized our forces against COVID initially.
Okay, well, it's been 5 months since the pandemic in Guyana, and how has the hospital been coping and their response?
Well, remember, COVID-19, no one knew enough about COVID-19. So COVID-19's behavior and manifestations have been dynamic. It has been changing from day to day, from month to month. And things that you thought were necessary sometimes had to be downgraded, or things that you thought were necessary had to be upgraded because you were not protecting or overprotecting. So for the 5 months, we have been going through a process, a learning process of the virus and what to do. So this made our hospital respond, and the way we responded basically was to at least set up processes in the institution that we were able to implement. For example, we started we call it the task force, the Georgetown Hospital Task Force, COVID Task Force, and this task force responded to the needs. It identified educational topics about COVID. It identified things that we needed to do for the disease, and then we started writing policies and protocols. And we are happy to say that the policies and protocols that were written at the Georgetown Hospital are actually going to be some of the policies and protocols that will be used nationally to assist with the fight against COVID. So some institutions can take our policies and protocols and modify them according to their needs and use them. So those were some of the things that we did over the months. And we thought that what we learned is that the national response to COVID has its ups and downs. And once again, I'm saying so because it's all about a learning process, and we didn't know everything about COVID. So the world was saying lockdown. We tried doing a lockdown. It was a partial lockdown. So we do not know if it completely accomplished what was necessary. I guess hindsight is always 20/20, but so we think that there were some problems with testing, with training. We train persons, and then when you go to check to see their implementation, you found that they were deficient or defective. So there were difficulties in the last 5 months. We have learned from those difficulties, and we're hoping that we can move forward and institute other measures that can take Guyana forward in the fight against COVID.
Could you tell us about the plans of the task force going forward?
Okay, so our task force kind of oversees the policies and protocols that should be implemented in the fight against COVID. So that's what the task force mainly does. And in this task force, which initially we would meet twice a week, now we are meeting once weekly because we have managed to accomplish most of what we needed to do. So it's basically making recommendations, making changes that will assist positively in the hospital and in the management of not only the patients but the staff in our fight. So the task force has lots of functions. We took persons from the task force to assist with the national task force. We had persons in our task force assist with training all around the country. Persons from our task force would take information and bring information to us that we are able now to implement to make the fight against COVID more like a national fight and not an independent Georgetown Hospital fight. So we have been working tediously to come up with measures to at least save ourselves from the wrath of COVID. And we know that there isn't very much that we can do other than take precautions, sanitize, and educate. And I think if we do those three things efficiently and effectively, we may be able to at least partially win the battle. Partially win the battle.
Okay, let's talk about the capacity of GPHC and other health facilities in COVID-19. I know there's more testing now, so there's a possibility that cases will rise. We've been seeing that over the past couple of days. And how prepared are these facilities to deal with this?
Okay, if I'm going to speak about the Georgetown Hospital first, I'll say to you that the Georgetown Hospital prior to COVID-19 was unable to cope with our regular work. Some areas of the hospital had more than 100% occupancy. So imagine now you have a pandemic and you have additional cases. So it is a dilemma. The Georgetown Hospital on its own had to make many changes. We had to reduce elective activity. We had to try to do telemedicine, try to keep patients who didn't need to come to the hospital. We had to try to keep them at home. And we would do regular calls, find out how they're doing, ask them to send someone to get their medication if they're doing fine. And all of this was an effort to maintain social distancing. But this was kind of working at the beginning. First month, second month, the fear of COVID was there. But then our population was apparently started to show that they're not certain about COVID. So they started coming back out on the street. They started coming back in large numbers. And presently the Georgetown Hospital, with its bed capacity, we are overwhelmed. So what are we doing with the present administration? We are working with the possibility of initiating the use of the institution that was developed in Ocean View so that we can start using that area for the spillover of patients. So our intention is to use that institution for patients who are sick, they are ill, they need to be in the hospital, but they are not critically ill that they need ventilatory support or intensive care. So the Georgetown Hospital will continue managing the critically ill patients, the ones who need intensive care, but we will try to have the transition patients and the ones that are not so ill at the Ocean View location so that we can at least overcome the difficulty we're having with accommodation. Today, for example, we have a transition ward, and we have 23 patients in the transition ward. Now, the capacity of the transition ward with social distancing and everything else is about 21. So, we are overwhelmed. Then we have a maternity unit that has a capacity of 5 beds, an isolation area. All of these things we built for the response to COVID. But now, sometimes our maternity unit has 9 patients. So a 5-patient area for 9 patients. How do you socially distance? So we have to use the West Demerara and Diamond as a place to spill off. But if this surge continues, then we will need more than West Demerara, Diamond, and the Georgetown Hospital. So the institution at Ocean View will probably be the institution that will help us to manage patients there, sick patients, as well as probably we can use it for isolation of positive patients who probably don't have a place to be isolated. So that's the plan for Georgetown. Now, out of Georgetown, I'm certain you know that there is also a big challenge. Most of the institutions out of Georgetown are smaller than the Georgetown Hospital. Lethem, Mabaruma, I know Mabaruma and Lethem Hospital very well. And for those institutions to be able to cope with the surge, they will have to probably expand their isolation area, the areas that they're treating COVID patients. I don't know if they have the capacity. That's something that the regional health services may be able to give you more information on. But from my understanding, it's going to be very difficult if we have a surge and the numbers of patients go up so much that our institutions may not be able to cope with those numbers.
So as we're talking about numbers, tell us about the capacity of the Georgetown Hospital right now.
Okay, the Georgetown Hospital, when it's related to COVID-19, we have an intensive care unit with a bed capacity of 12 to 14. And you're probably, why did I say 12 to 14? Because we have 6 beds in a room, but if pushed to, because our numbers are going up, we have decided we can probably put 2 extra beds in the room to accommodate 14 patients. So our intensive care is 14. We have built a transition room that also houses critically ill patients, and that has a bed capacity of 4. So that's 18. And then on the outskirts of these intensive care beds, we have approximately 21 beds, and we have cots for 2 infants. So if our numbers go higher than that, we cannot have more patients for COVID diagnosed or COVID suspect at the Georgetown Hospital.
Have you ever been in a position where the numbers have gotten higher?
Every day. So some days we are full in our transition area, and we have patients waiting at the emergency room to be admitted to the transition area. So when that happens, we now have to find ways to get the patients their results, get them out of the unit, get them to another place. Remember, we cannot move them out of the unit unless we have a result, either a negative result or a positive result. So when you have a positive result and the patient is not that ill, then we can say, okay, West Demerara, we can use the facilities at West Demerara, we can use the facilities at Diamond, and now we're hoping that we will be able to use the facilities at the institution at Ocean View very soon. That's going to help us. But we have had many days, many instances where our capacity, we were full to capacity and overflowing. And especially in these last few weeks, when you've noticed there seems to be an increase in numbers of COVID patients.
Okay, I know the public is not aware of some of the things you just told us. What would be your advice to citizens, regular citizens out there who just keep going about their daily routine as though COVID is not anymore or a cure has been found? They do not know of the challenges you face on a daily basis at the health facilities like the Georgetown Hospital.
Well, what I would say to the regular public is that COVID exists and COVID is real. And we see what happens to patients who are COVID positive and are severely ill. Our death rate is also going up. And my advice to the public is there are rules, there are advisories that are going out to the public that you should wear a face mask, you should socially distance, you should try to stay at least 6 feet apart where possible. You should only go to places that are safe. Do not, I've noticed persons on the streets at night, at a corner, they're drinking alcohol, they are smoking, they are having a small party, and that is dangerous because amongst you, you can have an asymptomatic person, no symptoms, no cough, no fever, but yet while you're in that group, you could be contaminated, you could become infected, and then you could be the unfortunate person who ends up in our COVID ICU and probably do not make it. So please adhere to the instructions of wearing a mask whenever you have to go out in public places. Please avoid getting too close to each other, so you need to socially distance. And only go to places that are absolutely necessary until we can define what is happening with COVID-19 in Guyana, and we can decide, what is the best thing to do. Right now, we still do not know, so you just need to be careful and adhere to the laws and rules that says wear a mask, socially distance, and only go to places that are really necessary.
Thank you for joining us. Today on our COVID-19 update, we spoke with Dr. Fawcette Jeffrey, the Director of Medical and Professional Services of the Georgetown Public Hospital Corporation. Thanks for joining us.